Welcome to our comprehensive guide on high-yield mental health topics for the NCLEX examination. As future registered nurses, understanding mental health is crucial, not only for the exam but also for your clinical practice. In this video, we'll focus on the most frequently tested concepts, ensuring you're well prepared for the mental health section. We'll cover essential disorders, therapeutic communication, crisis intervention, and legal ethical consideration. Let's dive in and make sure you're ready to tackle these questions with confidence. Strong foundation in mental health disorders is vital for NCLEX success. The exam often tests your ability to recognize symptoms, prioritize care, and understand the underlying pathophysiology of common psychiatric conditions. Disorders such as depression, anxiety, schizophrenia, and bipolar disorder frequently appear in exam questions. Knowing the hallmark signs, risk factors, and nursing interventions for each will help you answer scenario-based questions accurately. Let's start by reviewing the most common disorders you'll encounter. Your depressive disorder is one of the most commonly tested mental health conditions on the NCLEX. You'll need to identify classic symptoms such as persistent sadness, loss of interest in activities, changes in appetite or sleep, and feelings of worthlessness. The exam may present scenarios involving suicide risk, so it's important to know how to assess and intervene appropriately. Nursing care focuses on safety, therapeutic communication, and medication management. Let's explore the key points you should remember. Bipolar disorder is characterized by alternating periods of mania and depression. On the NCLEX, you may be asked to differentiate between manic and depressive episodes, recognize risky behaviors, and prioritize interventions. Manic episodes often involve elevated mood, increased activity, and impulsivity, while depressive episodes mirror those of major depression. Nursing care includes setting boundaries, ensuring safety, and monitoring medication adherence. Let's break down what you need to know for the exam. Schizophrenia is a chronic psychiatric disorder marked by disturbances in thought, perception, and behavior. The NCLEX often tests your ability to identify positive symptoms like hallucinations and delusions, as well as negative symptoms such as flat affect and social withdrawal. Nursing interventions focus on building trust, promoting reality orientation, and ensuring medication compliance. Safety is always a top priority, especially if the patient is experiencing command hallucinations. Let's review the essentials. Anxiety disorders, including generalized anxiety disorder, panic disorder, and phobias, are frequently tested on the NCLEX. You'll need to distinguish between normal anxiety and pathological anxiety that interferes with daily functioning. Key nursing interventions include providing a calm environment, teaching relaxation techniques, and supporting the patient through panic attacks. Understanding the differences between disorders and knowing when to escalate care are crucial for exam success. Obsessive compulsive disorder, OCD, is characterized by intrusive thoughts, obsessions, and repetitive behaviors compulsions. The NCLEX may present scenarios requiring you to identify these patterns and implement appropriate interventions. Nursing care involves supporting the patient's coping mechanisms, teaching alternative strategies, and avoiding criticism of compulsive behaviors. Medication management and cognitive behavioral therapy are also important aspects of care. Post-traumatic stress disorder, PTSD, often appears in NCLEX questions, especially in relation to trauma-informed care. Symptoms include flashbacks, hypervigilance, and avoidance behaviors. Nurses play a key role in providing a safe environment, building trust, and teaching grounding techniques. It's important to recognize triggers and respond with empathy and support. Let's look at the high-yield points for PTSD management. Personality disorders, such as borderline, antisocial, and narcissistic personality disorders, are tested for their impact on patient interactions and care planning. The NCLEX may ask you to identify manipulative behaviors, set boundaries, and maintain consistency in care. Understanding the unique challenges of each disorder helps you provide effective support while protecting yourself and other patients from potential harm. Substance use disorders, including alcohol and drug dependence, are high-yield topics on the NCLEX. You'll need to recognize withdrawal symptoms, understand detox protocols, and provide non-judgmental support. Nursing care includes monitoring for complications, promoting abstinence, and connecting patients with community resources. Let's discuss the most important points for managing substance use disorders. Eating disorders, such as anorexia nervosa and bulimia nervosa, require careful assessment and intervention. The NCLEX may test your ability to identify physical and psychological symptoms, prioritize safety, and support nutritional rehabilitation. Nursing care involves monitoring vital signs, preventing complications, and fostering a therapeutic relationship. Early intervention is key to positive outcomes. Therapeutic communication is a cornerstone of mental health nursing and a frequent focus on the NCLEX. You'll be tested on your ability to use open-ended questions, active listening, and non-judgmental responses. Avoid giving advice or making value judgments. Instead, focus on building trust and encouraging patients to express their feelings. Let's review the most effective communication techniques. It's equally important to recognize non-therapeutic communication techniques which can hinder patient progress. The NCLEX may present scenarios where you need to identify and avoid barriers such as false reassurance, changing the subject, or minimizing the patient's feelings. Understanding what not to say is just as crucial as knowing the right words to use. Crisis intervention skills are essential for managing patients experiencing acute distress, such as suicidal ideation or psychosis. The NCLEX tests your ability to assess risk, ensure safety, and implement immediate interventions. Always prioritize life-threatening issues and use de-escalation techniques when necessary. Let's discuss the steps for effective crisis management. Suicide risk assessment is a critical skill for nurses. The NCLEX may ask you to identify warning signs, ask direct questions about suicidal thoughts, and implement safety measures. Always take any mention of suicide seriously and follow institutional protocols. Removing harmful objects and providing close supervision are key interventions. Managing violence and aggression is another high-yield topic. The NCLEX may present scenarios involving agitated or aggressive patients. Your role is to maintain safety, use non-threatening body language, and set clear limits. If necessary, involve the healthcare team and use restraints only as a last resort following strict guidelines. Legal and ethical issues are frequently tested in the mental health section of the NCLEX. You'll need to understand concepts like informed consent, confidentiality, and the right to refuse treatment. The exam may also ask about involuntary commitment and the nurse's role in advocating for patient rights. Let's clarify these important principles. Involuntary commitment is a legal process used when a patient poses a danger to themselves or others. The NCLEX may test your understanding of the criteria for commitment, the nurse's responsibilities, and the patient's rights during this process. Always ensure that patient dignity and legal rights are respected throughout. Confidentiality is a cornerstone of mental health care. The NCLEX may present scenarios where you must decide what information can be shared and with whom. Exceptions to confidentiality include situations where there is a risk of harm to the patient or others. Always follow legal and ethical guidelines to protect patient privacy. Medication management is a frequent focus on the NCLEX. You'll need to know common psychotropic medications, their side effects, and important nursing considerations. This includes monitoring for adverse reactions, educating patients about adherence, and recognizing signs of toxicity. Let's review the most commonly tested medications. Antidepressants such as SSRIs and tricyclics are commonly prescribed for depression and anxiety. The NCLEX may ask about side effects like serotonin syndrome, orthostatic hypotension, and the importance of not stopping medication abruptly. Nurses should educate patients about expected effects and monitor for mood changes. Antipsychotic medications are used to treat disorders like schizophrenia and bipolar disorder. The NCLEX may test your knowledge of extrapyramidal symptoms, neuroleptic malignant syndrome, and the need for regular monitoring. Nurses play a key role in educating patients about side effects and ensuring medication compliance. Mood stabilizers such as lithium are essential for managing bipolar disorder. The NCLEX may ask about therapeutic levels, signs of toxicity, and the importance of regular blood tests. Nurses should educate patients about maintaining hydration and avoiding sudden changes in sodium intake. Anxiolytics, especially benzodiazepines, are used for acute anxiety and panic attacks. The NCLEX may test your understanding of side effects like sedation, risk of dependence, and withdrawal symptoms. Nurses should teach patients about safe use and monitor for signs of misuse. Therapeutic milieu is an environment that promotes healing and safety for psychiatric patients. The NCLEX may ask about the nurse's role in maintaining structure, setting limits, and fostering a supportive atmosphere. Consistency and predictability are key to reducing anxiety and promoting recovery. Group therapy is a common intervention in mental health settings. The NCLEX may test your knowledge of group dynamics, the nurse's role as facilitator, and the benefits of peer support. Nurses help establish ground rules, encourage participation, and address conflicts as they arise. Family involvement is often crucial in mental health recovery. The NCLEX may present scenarios where you need to educate families, involve them in care planning, and provide support. Nurses should respect family dynamics while advocating for the patient's best interests. Cultural competence is essential in mental health nursing. The NCLEX may test your ability to provide culturally sensitive care, respect beliefs, and adapt interventions. Understanding cultural differences in symptom expression and treatment preferences can improve patient outcomes. Patient education is a key nursing responsibility. The NCLEX may ask about effective teaching methods, assessing readiness to learn, and reinforcing information. Use simple language, visual aids, and repeat important points to ensure understanding. Tailor education to the patient's needs and abilities. De-escalation techniques are vital for managing agitated or aggressive patients. The NCLEX may test your ability to use calm communication, maintain a safe distance, and avoid confrontational language. Early intervention can prevent escalation and ensure safety for everyone involved. Restraint and seclusion are last resort interventions for managing dangerous behavior. The NCLEX may ask about appropriate indications, monitoring requirements, and documentation. Nurses must follow strict protocols, ensure patient dignity, and use the least restrictive measures possible. Electroconvulsive therapy (ECT) is used for severe depression and treatment-resistant mental illness. The NCLEX may test your knowledge of pre- and post-procedure care, potential side effects, and patient education. Nurses play a key role in preparing the patient and monitoring for complications. Distinguishing between delirium and dementia is a common NCLEX challenge. Delirium has an acute onset and fluctuating course, while dementia is chronic and progressive. Nurses must assess for reversible causes of delirium and provide supportive care for both conditions. Mental health issues in children and adolescents, such as ADHD, autism spectrum disorder, and conduct disorder, are increasingly tested on the NCLEX. Nurses must recognize age-appropriate behaviors, involve families, and advocate for early intervention and support services. Geriatric patients may experience depression, anxiety, and cognitive decline. The NCLEX may test your ability to assess for elder abuse, promote independence, and address unique medication concerns. Nurses play a vital role in supporting older adults' mental health and quality of life. Sleep disorders such as insomnia and sleep apnea can impact mental health. The NCLEX may ask about assessment, non-pharmacological interventions, and patient education. Nurses should promote good sleep hygiene and identify underlying causes of sleep disturbances. Grief and loss are universal experiences that can affect mental health. The NCLEX may test your understanding of the stages of grief, appropriate interventions, and supporting patients through bereavement. Nurses should provide empathetic support and recognize complicated grief reactions. Stress management is an important aspect of mental health care. The NCLEX may ask about teaching patients relaxation techniques, time management, and coping strategies. Nurses should model healthy behaviors and encourage patients to develop personalized stress reduction plans. Self-care is essential for nurses working in mental health settings. The NCLEX may include questions about recognizing burnout, seeking support, and maintaining work-life balance. Nurses should prioritize their own well-being to provide the best care for patients. Accurate documentation is critical in mental health nursing. The NCLEX may test your ability to record observations, interventions, and patient responses objectively, avoid subjective language, and ensure all entries are timely and complete. Connecting patients with community resources is a key nursing role. The NCLEX may ask about referrals to support groups, crisis hotlines, and outpatient services. Nurses should be familiar with local resources and help patients access ongoing support after discharge. Advocacy is a fundamental nursing responsibility. The NCLEX may test your ability to advocate for patient rights, access to care, and stigma reduction. Nurses should empower patients to participate in their care and challenge discrimination in all forms. Effective test-taking strategies can boost your NCLEX performance. Read each question carefully, eliminate clearly wrong answers, and look for clues in the scenario. Prioritize safety and use the nursing process to guide your choices. Practice with sample questions to build confidence. Let's recap the most important mental health topics for the NCLEX. Major disorders, therapeutic communication, crisis intervention, medication management, legal ethical considerations, and patient education. Focusing on these high-yield areas will help you approach the exam with confidence and competence. As you prepare for the NCLEX, remember that mental health nursing is about compassion, critical thinking, and advocacy. Review these high-yield topics, practice with sample questions, and trust in your training. You're well on your way to becoming a confident and competent registered nurse. Good luck on your exam.